Lower eyelid bags, or baggy eyelids, they occur as you get older. Mainly they run in the family, so if your parents have had lower eyelid bags, you've got a very good chance of getting them as well. They are little fatty protrusions of the normal fat of the orbit that, as these layers of the lid get a bit weaker as you get older, they forwardly prolapse over the edge of the bone and they look like eyelid bags. And so they have to be assessed, and then hopefully we can remove them through a transconjunctival approach, meaning from the inside of the eyelid, through an approach that doesn't require any stitches or sutures at all. Surgery for lower eyelid bags is done under local anaesthetic. It's done as a day case. You'd have your surgery done here at Clinica London. However, during the assessment, because every patient is slightly different, with the lower lids I also have to make sure that there's no skin that has to be taken out as well. So I assess the skin laxity, and I also assess the lower eyelid laxity to see whether I need to put some special sutures at the corner to hold up the lid during the surgery and for the first few weeks afterwards. And I make sure you don't have a dry eye, because if you have, I have to take special precautions, perhaps putting in a punctal plug or giving you extra eye drops afterwards. So lower eyelid bags can certainly be dealt with surgically, usually from the age of about 50-55 upwards. If you have just small eye bags before that, we can very often correct them by very careful and delicate use of hyaluronic acid gel, by using the tear fill, which is the cannula administration of the gel, something like Restylane or Juvederm, into the upper cheek and tear trough. That can hide the eye bag. But as you get to being more age 45 to 55, it's at the borderline of whether you'll be all right with filler, hyaluronic acid gel, or whether you're going to need surgery for it. So it's very important that you have your assessment done by a properly trained oculoplastic surgeon who's used to examining and assessing around the eyelids, including the health of the eye for the dry eye, and who can deal with any complications that could occur with any treatment of lower eyelid bags.